Hey everybody, it's cold and flu season and a lot of kids are getting ear infections. You may be wondering, well, how do we treat ear infections? Well, a lot of people take antibiotics for them and that seems to work. Unfortunately, there's a lot of data that says when you take antibiotics to cure ear infections, then it seems to recur within a few weeks again. So a lot of people get multiple ear infections or chronic ear infections. A lot of kids go through that, unfortunately. It can be very painful and difficult and uncomfortable. And also, we don't want to put kids on a lot of antibiotics anyways because it's not good for their digestive tract and their overall immune system. And so there are some alternatives for that. Being a chiropractor, I want to answer the question of, can chiropractic help with ear infections? There's three separate things we do in my office for ear infections. I've done this with my children. I have 3 kids, and middle ear otitis media, that's the one that you want to create drainage because fluid builds up. Bacteria grows in fluid that's stagnant, like a swamp. If it's a river, if it's flowing, fluid builds up, drains, builds up, drains. It doesn't become infected. So it's because fluid's not draining that kids get these ear infections. Pressure builds up, and that's where the pain comes from. We want to promote drainage as opposed to just spraying the swamp with disinfectants and killing the bacteria. When we get it to drain so that that bacteria can be disposed of and it doesn't keep coming back. So a couple of things happen. If there is a misalignment in the top of the neck, a C1 vertebra or the atlas misalignment, we call that a subluxation. Anytime there's pressure on a nerve, anytime a nerve is irritated, the muscle that that nerve goes to will become tense and tight. If there's a nerve interference at the very top, there's a small muscle underneath the eustachian tube called the tensor villi palatini muscle. That muscle will get tight and tense and it stops drainage of the fluid of the ear. Sometimes it's on both sides. And so whenever we check to see if there's a misalignment at the top, if there is a misalignment, we deliver an adjustment to correct that misalignment. Pressure comes off the nerve, the muscle relaxes, the ears start to drain into the throat. Another one is the second vertebra in your neck. When C2 gets rotated to one side or the other, it causes this muscle called the SCM, sternocleidomastoid muscle, to become tense. How would that affect your ears? Lymph drainage happens through the anterior cervical lymphatic channels. And so if this muscle is tight and tense, it stops drainage of lymph, and lymph can actually back up into the sinuses and the ear and cause pressure there and ultimately lead to infections. The third one is the actual ear can have pressure inside it. One of the things chiropractors do, we do in our office, is it's called an ear adjustment, where we use the earlobe and we move it in a specific pattern, and you'll actually hear a pop inside the ear where pressure comes out and the ear starts to drain. So if we check all 3 of those in kids who may have ear infections, literally I've seen ear infections disappear within 12 to 24 hours. And this has been the case with my children as well. If it can be done in a short period of time, naturally, there's less need for antibiotics. Now, please remember, I'm not telling you to not take antibiotics. If your doctor prescribes it, pediatrician prescribes it, they know best. They're telling you what to do what they say. However, if you try chiropractic for that ear infection, I think you'll see some miraculous, pretty impressive, amazing results. I pray that you never have an ear infection, that your kids are always free of ear infections because they're painful. So I hope this helps you. Please share the video. Please comment. Let me know what you're thinking. Like and subscribe, and we'll bring you more soon. Take care.